Sorry. Let go. More, just a little bit more, don't worry.
Don't worry, everyone.
Hello, dear friends. We welcome you as always. A patient has come to us. Her name is
Marina.
So Marina, go ahead yourself. Maybe briefly, maybe not briefly. I have
Quite a tall height. I started growing taller, although in kindergarten I was still quite short, the shortest in the group. Because of this, apparently, my spine couldn't keep up with my growth and I constantly had back problems. My parents took me to a manual therapist, trying to somehow straighten it out. Maybe they did straighten it, I don't know, but the problem still remained. Basically, it's the cervical spine that bothers me, with pain radiating into my right arm. Sometimes my right arm goes numb and my neck doesn't turn well, especially to the right side. In short, that's probably about it.
Yes, and there's no need to come down hard on Maria. The spine doesn't calm down, it keeps growing. What I mean is, you have to understand that a patient is not a professional, and most likely, it's just that the muscles couldn't keep up with the growth of the bones. That's usually how it happens, because we, as people, grow in spurts. These growth spurts especially happen during adolescence, specifically during school years. So if our parents are vigilant and keep an eye on us in time, send your children to therapeutic exercise classes and for massages. In general, take care of your backs. We actually have children who come in. If we're talking about manual therapy, the approach to children is completely different. Keep this in mind, the way we work with Marinka.
It's not the pediatric approach.
Yes, right now Pompan is not writing. So we don't work with children, that's important to understand. And of course with elderly people as well. And by the way, we have them too. Let me assure you, I'll digress just a little. I truly want to thank absolutely everyone. We've successfully reached the incredible milestone of 100,000 wonderful subscribers. For me personally, that's a huge and significant achievement, and it's completely and utterly thanks to each and every one of you. I am simply doing my job, and you are currently watching it unfold. If you kindly subscribe, thoughtfully like, and genuinely comment, it truly means you thoroughly enjoy what I passionately do. And what I enjoy is that we've successfully reached this incredible level together, and we are absolutely not going to stop here at all. We are continuously growing and expanding, so I truly want to express my sincere gratitude to each and every single one of you wonderful people, sending big, warm and heartfelt hugs to all of you. Maren, we are now coming back to you, if you please. Let's just rewind a little bit. You previously told us all about your fascinating protrusions, didn't you?
Yes. I remember very well which discs exactly, where they're located.
So the situation is as follows, according to the patient, specifically Marina. She said that she had an MRI of the cervical spine done in March, and there were protrusions up to 3 millimeters. She consulted a medical specialist. Again, according to Marina, the specialist was primarily focused on osteopathic therapeutic methods.
It was more like targeted work, so to speak. There are certain points on the back that he specifically worked on, relaxing the muscles in those areas.
Well, roughly speaking, let's just call them trigger points. She started to feel better.
Yes, the numbness in her hand went away, including in her fingers. She's able to walk and function. I guess that's a plus.
Wonderful. What could be better? All right, now we'll move on to the examination. Unfortunately, we don't have the disc. As I understand it, it was lost. Well, no worries, we'll bring it back, so to speak. All right then. Now, we'll give Marina some time to change. Don't go anywhere, we'll be right back. All right, we're all basically ready. Let's move on to the examination. Marina, I see you don't mind everyone being here.
I don't really have a choice, do I? Whatever.
Go ahead, stand up. I'd like to ask the camera operator to come closer. Visually, again, I say visually because we always make the final diagnosis based on MRI studies. So what we see is hyperlordosis of the lumbar spine. Can you see it? Well, you get it, you can see it, you're a doctor too. Take a deep breath in, breathe out, and relax. Varric, what year were you born?
Me? 91, 91.
Here we have actual trigger points. I think Marina,
I can feel them. Yes, of course.
you can't do without them. I'll ask you to tilt your head.
Like this?
Do you feel any tension?
Yes, I do.
Here we grab the trapezius and if possible the scalene muscle too, but for the scalene you need to tilt. So the patient should turn their head to the left, for example. That's not the left side. And here, since we can palpate the anterior, middle and posterior scalene muscles, you can have some fun with that. You can also grab the trapezius here. Think of it as a tip. Do it however you like. Basically, if your neck and shoulder area feels a bit sore or tense, you can simply ask your husband, your wife, or truly anyone around you, even the kids, whoever you feel comfortable with, to kindly help you out. So, literally and firmly grab onto the trapezius muscle and gently pull your chin toward your chest. Hold that position for a brief moment, then slowly come up, return to the starting position, and then carefully repeat the entire process. Good. Now gently turn your head slowly left and right. You should feel a little bit more freer. We'll come back to that. But the whole point is that it's precisely during this movement that you stretch the muscles, and for the patient, well, that is, the person who's experiencing discomfort will feel some relief, but in general, I think we won't, look at the bend right now. Well, there's really no point in that. At least I don't see any from my perspective. Well, sort of, to do it on the fly, honestly, from scratch. Maria, I'm going to take your microphone now. And you lie down on your stomach. Unpacking. So, Marina, you need to stand up now. I almost forgot to check. Just kidding, just kidding. All right, relax. Marina, have you had any injuries at all? None? We can see that there is a noticeable slight kyphosis in the thoracic region of the spine. Or am I the only one who sees it? Does anyone else here see it? Do you see it? Thank you. I really love it when you support me. Our shoulders are forward. Naturally. Just relax and take it easy a little bit. All right, okay, good. I guess basically we can go ahead and start the massage now, the manual therapy itself. We'll turn you over, rotate you, and let go.
Yes?
We did what we could, to the best of our abilities, basically, in essence. Gave a relaxing massage, but you'll see everything up close. So, Marin, we'll gently start with your lower back area. Just completely relax now. All good. Grew up always with a towel. That's my joints cracking, people, not the autopsy will tell. Relax. More, just relax. Not tricky at all. That's much better. You are truly laughing now. Moving on. This experience is incredibly relaxing, providing a profound sense of calm and tranquility, allowing one to unwind completely and find inner peace. Now, the thoracic area. Breathe. More. A bit more. Good. We'll compensate for all this again when you're on your back. I'll explain why. Because the chest, so as not to put pressure on the chest in this position, I'm letting go of the shoulder. Sorry. Lowering the arm. There, which arm isn't nice. By the way, the right one. So now I'll need a little bit of time, but for the setup, let's gently turn onto your right side and then look for the right side. All right, right, just closer to me so I can actually take this off right here. Okay, as soon as I take it, turn over toward the viewers. Sorry, just the other side. The operator needs to record this. Perry, please record it again. Come closer to me a little more, just a bit more, please. They're falling here. Turn your torso. Lie on your back. Regarding the issue with the thoracic area, sometimes it's such that you can't work on it while lying down. In that case, we turn the patient onto their back, like we're doing now. Why didn't I press hard? So as not to press on the chest. Arms crossed over the chest.
Okay, so let's record it like a thrilling slide in a large water park. All right.
Here, without a pipe. Everyone just relax now, please. That's really good. Put your hands firmly on your left side. Then turn around and then sit down comfortably. Plus or minus. So. Okay, I'm done for now. Yes, a vibrant green. I truly need it right now. Come in here. Place your hands firmly locked behind your head. Gently bring your head down towards your chest. Now, slowly and deliberately open the set, extending your body fully. Wait. Stand on your heels.
On heels?
Yes, and on me. Lower your entire pelvis in addition. That was the upper thoracic part just currently. Is it properly in place?
Yes.
Lock your hands behind your head. And now on the contrary, we need to lower the lock a bit and round your back. A little lower with the lock. Everything grew perfect. I actually liked it. Sit down. I'll explain why. Because the pressure already caused it to happen. So, let's just sit here very calmly and comfortably for a moment. Now, I am carefully going to begin to gently twist your neck around ever so slowly. Straighten your back. Bend forward. Relax, relax. There we go, found it. Neutralized.
Oh my gosh. That's a powerful cannon.
Relax. More. Don't worry. Lie on your stomach. Arms along your body, chin on the mat. I'll also tell you another option now. So we need to do a side stretch. Basically, we need to fixate. Usually the shoulder blade is used for this. But for those who have been doing this for a long time, it's clear that they can manage it. Sorry, I forgot to mention. But sometimes when it's really hard, we lay it down. And in doing so, now we have a much better lever for better leverage. Maria, now well, you've truly got it. Stretch even more and more, just exactly like that. Absolutely perfect. There, you beautifully go. So transformation, integration, then compression. So basically we all said that Marina didn't understand anything. Let's move all this to McDonald's. Were you stretched out? There, it didn't crack.
And there, it didn't crack.
Let's do it one more time.
Hello there. We're still alive. Let's keep going.
Marina, please go a little bit lower. That's quite enough for now. And now let's relax. I said relax, let your head drop. What kind of guy is this, huh? It's really nothing special. All right, jokes aside, seriously. Let's see. I'm taking this too, by the way. By the way, about hyperlordosis. Marina's hand here. It shouldn't go in like that. Marina, relax. Well, we have a patient. A special shout out to you. He's coming to us for treatment now. If you're watching us, we showed you this as well. And basically, for our viewers, we'll show you too. The hand shouldn't go under the lower back. There should be resistance. So Mari, they're going to take the microphone away from you. You're staying quiet anyway. Basically, you can spin that stick or whatever it's called. And we will continue on. So there is an option to do it in a more brotherly way. Thank you very much for that. All right, let's move on to the hip joint and the ankle joint. You don't mind, do you? Yeah, well, who's even asking you? Relax your leg. Let it go. More. That's it. She won't let go of her leg. Can you believe it? It's all good. Everything's fine here. No, I mean, let the joint move. So basically, there's no need to mess with it. So, in other words, it doesn't need to be set back in place. Now, let's check the other one. Let it go. More. And here, either our patient is actively holding it, or we've clearly got a significant blockage. Well, basically, we will certainly find out more about that situation now. It grew more. Let go, relax, release. Let it go. It moved a little. With this joint, you really need to work on it. Ideally, you should be walking stylishly.
I don't know what came from the factory there. The factory.
Well, yeah, I agree. I didn't emphasize that the orthopedic relax your leg. Let it go. Don't stimulate it, let it go. Now turn over onto your stomach and get up on your elbows. Well, on your forearms. Don't worry, not everyone will put their elbows together.
Okay.
Lower your torso down. Here on the transverse process, we'll place 2 fingers and after decompression, gently stretch. Once more, Slav. More. Sorry, but it had to be done. All right. Stand up, please. Come over here.
I'm coming right now.
Adjust it. Stand like this. Is your left or right side like everyone else's? Take a small step. That's it. You grew. Well, in general, don't pay attention to us. We have our own kind of fun sometimes. We're filming. Take a small step to the left. That's not left. Lift. I'm going sideways. You grew. Let go of everything. Now cool and calm down a bit. So, I opened the door for the patient. The next one is Marina. Today we're done. As a recommendation, we'll do an MRI of your cervical spine. The device has the power of 1.5 Tesla. Please provide us with any media, disk, flash drive, link. Anyway, whatever, say goodbye.
See you all very soon again, everyone.
Wait,
Contact your doctor. Only positive recommendations about crunchy bones. I'm in a good mood. I survived. I'm going.
good job, you feel better now.
It's much easier now. My neck moves freely, and everything seems perfectly fine. My head isn't spinning at all.
Alright, as long as she's on her feet. Let's let you go. You're all set for today. See you next time. Thank you all for watching. Subscribe, like, and keep commenting. I don't remember. Goodbye, everyone. See you next time.
Come join our group, BDSM Practices. See you next time.